This is Bernard Bendock from the Department of Neurosurgery at Mayo Clinic in Arizona. Most brain AVMs cannot be cured with glue embolization alone. 5% of such AVMs, however, can be cured with this modality. This is a 71-year-old gentleman who presented with a sudden explosive headache and was found on MRI to have a right frontal lobe AVM with hemosiderin stain around it. It was thought that he may have had a sentinel hemorrhage from this AVM. Unfortunately, he was a very poor candidate for general anesthesia due to significant pulmonary comorbidities. A cerebral angiogram showed a right frontal lobe AVM with a compact nidus, a single feeding artery, and a single draining vein. This is the kind of architecture that can be considered for glue embolization alone when using onyx. AVMs that are more complicated in terms of the number of feeding arteries, number of draining veins, and larger nidus are typically not a good candidate for glue embolization alone as the primary modality for cure. In this case, we catheterized the feeding artery and we parked the microcatheter just proximal to the nidus. Using onyx, a cast was built around the distal tip of the microcatheter, allowing us to infuse the entire nidus in a very safe and effective way. This AP X-ray shows excellent and complete occlusion of the nidus. The patient awoke without neurological deficits and was sent home the next day. A 1-year follow-up angiogram showed no evidence for recurrence. This patient was not a good candidate for surgical resection because of his significant pulmonary comorbidities. When treating AVMs, it is very important to match the right treatment to the right patient. This is an example of an AVM that was successfully treated with glue embolization alone. It is important to keep in mind that the vast majority of intraparenchymal brain AVMs cannot be cured with glue embolization alone. Thank you.